Friends, today's NRI Samay program from Los Angeles brought to you commercial free by listeners like you. Your generous donations make possible for us to stay commercial free, and today's show is pre-recorded. If you have a question for the guest, please send an email to nrisamay@gmail.com. We will follow up with the guest and find the answer for you. Thank you for your support.
So friends, welcome back to NRI Samay. Today we have Somnath Mukharji. He is a full-time volunteer at AID, which is Association for India's Development. If you are following NRI Samay, we have done several shows with them, including the interview with Ravi Kuchimanchi. Which was recently. So today we are going to talk about one of the AID supported programs, which is called Jana Swachha Sahyog.
Yes.
And this is in Chhattisgarh, and it's related to healthcare. So let's hear it from Somnathji, which is who is involved in this program. Somnath, could you please tell me about Jana Swachha Sahyog?
Yeah, Jana Swachha Sahyog or JSS was an effort started by about 10 doctors who had graduated from All India Institute of Medical Sciences, and very bright doctors, and they decided that instead of going into private practice or other practice, they would like to work for the most underserved population of India. And they opened up this hospital in a dilapidated government building in a village called Ganyari in Chhattisgarh, in the Bilaspur district, which is there even now. So that was about 12, 13 years ago. And so their model has been a unique model actually, where, healthcare for the poor in India is, they don't see it as a medical issue or just a clinical issue. There are a lot of social determinants of ill health for the poor in India, and they try to take a holistic approach to what health or lack of health care means for the poor in India, and how do we make models, how we demonstrate models to get low-cost, rational, but high-quality healthcare to the poor of India. So in a very, very short, their main model is they start at the village level. They work in about 70 villages, which are very remote, mainly tribal population. Many of them are villages in the forests. So they work at the village level first, where middle-aged women in the village are trained, mainly women, there are some men also, are trained to become primary healthcare workers, village-level health workers. So they are able to detect symptoms, treat some minor illnesses, respond immediately to emergencies. That is the first level of defense. The second level of defense are the sub-centers, which are located in the village itself, but one sub-center serves about maybe 15 to 20 villages, where a senior level health worker is there. There is more medication. There are some solar run refrigerators which can keep vaccinations or other things from going bad. And then the third level and the final level is the large clinic, the rural clinic in Ganyari, which is a full-fledged hospital actually, with about 60 beds, with facilities to do surgery and all of that. So this is a model in which they work, and it has shown to be very, very successful. But the unique thing with them also is that they work on many other issues which affects health. So even although they're medical professionals, they see that tuberculosis, rheumatic heart problems, all these things are directly affected or mainly an outcome of undernutrition or hunger, as they call it, without sugar coating and the word. So they work on agriculture, they work on, providing new protein supplement to tuberculosis patients and all of that. So they have developed a very holistic model which can be, implemented across India to get health care to the poorest person of India.
Excellent. You mentioned that there are a group of doctors who are trying to do this. I was on the website and I noticed that some of these doctors trying to complete their curriculum, or are they like full-time who are relocated and they're pretty much doing this as not as a career but as their lifestyle?
Yes, actually, the main the couples. Actually, there were about 5 couples who were all doctors. The 10 people who started JSS were full time into it. That was their that, and still are. That is their life passion. That is their career. That is their everything, and they have really excelled in that. But on top of that, there have been other people who have come and helped, and some of them recently are some young graduates who are, socially motivated. They want to work for the poor of India. So they come and they have been, spending a year or two working there. And then there are other doctors who go, take time off from their regular work. And some of them are even outside India, in the U.S., in Scandinavian countries. They go and they spend, 3 to 4 months there, and then they come back to their jobs. So, but to answer your question, the people who started it do it day in and day out.
I see. And could you tell what are the? I mean, this is mainly focused on Chhattisgarh, right? Bilaspur district, Chhattisgarh. So can you tell me about what are the primary issues that the local people are facing in terms of their health, and how it is related to the rest of their life?
Yes. So, like I said, Chhattisgarh, the rural population is Chhattisgarh is a very deprived population of India. Some of the poorest communities of India live there, and I have traveled through many of those villages for several years, and the level of deprivation is just unbelievable. People living in the cities who have not been there, it would be a shock to know that in the 21st century in India we are living with our fellow compatriots who don't have enough to eat and don't have enough clean water to drink. So that in some ways is one of the main issues in that area. Like I said, hunger. People don't have enough to eat, and that compromises their immune system, and then they are exposed to tubercular germs and they get a lot of tuberculosis. There are many instances of tuberculosis that JSS sees, and just day before yesterday the doctors published a very nice paper on tuberculosis and its linkages to undernutrition. The average weight of men coming in, I think, is about 40 kgs or something like that, or people with tuberculosis, and 36 for women. So like severely underweight, and the average body mass index of these people is 16. 16 almost medically. They say it like severely malnourished. 18.1 body mass index is the starting of undernutrition. So 16 is considered to be getting very close to a level which medically they call the body content of the body fat content being incompatible with life. But, we have seen people there with body mass index of 11, 12, and 13, living skeletons. That is a huge thing in the and because of a lot of reasons, one of them being poor agriculture also, and not very good support for agriculture, when agriculture is the main one of the main things that they do for a living. So this kind of hunger is a massive issue. Another major issue in that area is a kind of malaria called falciparum malaria. So the falciparum malaria affects your brain, and if they are not able to detect it in there's a short window of time. I'm not sure exactly what it is, but something like 5 to 7 days. So if you go undetected and untreated for 5 to 7 days, it is fatal. And falciparum malaria takes the lives of obviously the more vulnerable, that are children and old people. So that is a huge issue in that area. There are every so often, maybe in 2-3 years, there's huge epidemics when this malaria flourishes and many people die. So JSS has been very effectively able to control this epidemic in the villages that they work in. The health workers are trained to respond immediately to any symptoms, that and around that time of the year, around October, November time, they are supposed to keep an eye for it. If there is anyone suffering from high temperature, convulsion, and whatever else the symptoms are, they're immediately referred to the sub-centers and then finally to the clinics, so that lives can be saved. And in 2010, there was an epidemic, and not one person died in the villages that they work in, whereas there were several other villages where many children had died of this. And I visited some of those villages with them, although they are not recorded in government records, but thousands of children had died within the district of Bilaspur. So I would say these are two, major. There are obviously many more, but these are two major issues in the area that they face.
Okay, it's good that aid is making a difference there.
Friends, NRI Samay is a non-profit independent alternate media from Los Angeles, USA, which brings positive stories from grassroots activists from all corners of India and across the world. NRI Samay does not rely on corporate funding, and our shows are commercial free. We only rely on your donations. Corporate funded media is driven by the TRP rating, and profits are blurring the distinction between news and entertainment. Why do our news channels talk so much about cricket, movies, accidents, popular figures' personal lives, babies of heroines, gossips, etc., while they should be covering the struggles of people, inequality in our society, rural issues, and border security issues? Why did our media raise some corruption crusaders to the sky on one day and shut them off completely when graft charges were raised on those corporate sponsors? Media relies so much on the corporate funding and government blessings that they cannot report independently. NRI Samay is different. We don't accept funds from any corporations, and hence our shows are commercial free. We completely rely on donations from you. Please consider donating to NRI Samay, and please go to nrisamay.com and donate generously. This is the only way together that we can continue NRI Samay. All donations are kept transparent on nrisamay.com. And if you have any questions, please write to nrisamay@gmail.com.
As far as the malnutrition and the hunger problem, unless they are fed properly nutritious food, it's not going to go away, right? So,
right.
What is a long-term solution do you see? Is it something like a food security bill that government is going to bring, or I think there is in Chhattisgarh there is something similar already, right? Is it true?
Yes, the PDS system, it works, and that's part of the solution definitely. But but it's a multifold solution of having a strong PDS, public distribution system, or the ration system, which does not let people go into starvation. Making sure people have livelihoods, and supporting measures that will bring livelihoods to people. So what has happened over the years is people have lost all livelihoods. So if you go into the village today, and I would say this for most of India, and not just Chhattisgarh, is that there are no livelihood options. Besides farming, there is nothing that is produced or made in the villages. So it's either people with land who do farming effectively, or people who do not have any land, they work a little bit on others' land, or they have to migrate to a city to make money. Those are the only options. And a lot of this tuberculosis effect comes from migrating to the cities, because in the villages, at least in Chhattisgarh again, they live in a very clean environment, a pristine environment. So when suddenly they are exposed to urban germs like the TB germs and other things, and their immunity is already compromised, they quickly catch that on. So, to address the issue of hunger, a lot of these issues have to be addressed. Along with, PDS system, livelihood has to be thought of. And the other thing that JSS does with tuberculosis patients is give them protein supplement. And by that, the hope is one day that it will also affect policy at the national level.
Yeah.
Where the national tuberculosis program will start offering protein supplement, because actually the TB medication is quite strong. So sometimes your body cannot even handle it without proper nutrition. So if a poor person doesn't have enough nutrition and we are trying to treat that person for tuberculosis, it doesn't make sense. It ends up doing more harm. So that is just this over this weekend I learned actually that the last tuberculosis drug that was developed was in 1972. So there has been no scientific research on coming up with better drugs for tuberculosis. It's a 6 months or a 6 months to a 9 month regime to treat tuberculosis, and and it has to be adhered to very closely. It's a very difficult treatment.
Yeah.
So that's a huge thing. But again, coming back to the question of hunger, several structural level things have to be addressed. Agriculture has to be supported, which also JSS does. JSS also is working on different modes of agriculture, dry land agriculture, by which it could perhaps if we develop it, can give a little more output to the people who are engaged in farming.
Yeah, that's true. I mean, that's the reason I asked about the holistic view, because you cannot see these as a separate issues, because the economics impacts the health, which impacts the education and their livelihood and pretty much everything, right?
Exactly.
Let's see. So, could you tell, from you are in US, how do you contribute to this project?
So, first of all, AID supports many of these initiatives. Raises financial support and supports them. So the malaria program was supported by AID partially. I'm not saying the whole thing is supported by AID. There was another unique program called the Fulwari program. What JSS identified that children under 3 are getting malnourished, partly because both their parents have to leave home and they are left in the care of the older sibling. And then, so they get underfed, and, the developmental problems in a child that sets in under 3 years is irreversible. So they have started something called the Fulwari, the creche, where, some mothers volunteer from the village. They're paid some money, but they take care of the children and feed them for the time that the parents are away. And that has made a significant difference in the health of these under 3 children. And now the government has actually taken cognizance of it and has said that it will be implemented across India. So it's a huge success that way. So this program was also supported from the very beginning by AID. Initially, it was a small part of the program AID was supporting, and then at some point, the entire program was supported also. There were other people also who supported it. There is a program for taking care of leprosy patients that was also supported by it. So this is one part where financially programs are supported. But more importantly, we develop the way AID works is in a partnership model. Where we learn as we work. We ask a lot of questions. We go there and we spend time and we try to understand why they are doing what they are doing, spend time in the villages. And so in a sense that, their work, the work of JSS, although it is, on the face of it is health work, but it actually opens up a window into the society where you begin to understand or at least see all the determinants that lead to this bad health. So a big part of it is learning. We try to, many of our volunteers go there and spend time and try to help out in, small ways of whatever it is. People who are medical doctors and all, they directly do medicine work, see patients and things like that. But that requires a little bit of commitment of, not less than 3 months. That is another way, documenting or doing data and things like that. So there is all these different ways where AID has been, involved with JSS and supports them.
Okay, that is excellent. And for the listeners who are listening to this conversation at this time, what would you like to say if somebody is interested in supporting? How can they do it?
So definitely, if you would like to support financially, you can donate to AID, and you can mark your donation for JSS. If you would like to go there and spend some time, and I would very highly recommend this because it is a transformational experience. It's a revolutionary experience, I would say. Once you see the society like that, it transforms you as a human being. So if you would like to go there and spend some time, we can arrange for that also. Living and eating, all those things are not a problem. JSS has a campus and there is a place to stay and there is a canteen that cooks. You can eat simple yet fresh food there and help them out and gain a lot of really good experience. You can do that. Or if you want to work even here as a volunteer with one of the chapters to support all these programs and all that, you can get in touch either with me or with any of the chapters that are close by in your city. Or you can just write to me on somnath@aidindia.org, and I can put you in touch with your a chapter that is closer to you, and we can take it from there.
Okay. Thank you very much, Somnathji. Friends, that's one of the projects that Association of India Development Aid is doing in India, in a remote place where they are making a change in in rural communities by providing healthcare and supporting projects. Thank you very much, Somnath, for your valuable time. I hope our listeners will get motivated and join in some of your efforts.
Thank you very much, Sri.
Okay, have a good day. Bye.
Okay, bye.
Friends, if you liked today's show, please go to youtube.com/NRI Samay and click on the subscribe button. You will get notified every time we publish a new show. And you can also like us on our social media sites like Facebook, Twitter, and Google+.